So coming to the appendicitis, acute appendicitis is relatively rare in infants. So it becomes increasingly common in the childhood and also early adult life. So reaching a peak incidence in the teens and also early teens. So is this going to be acute appendicitis? The sudden onset of the inflammation of the appendix is the most commonly seen in the late teenagers and also early 20s are going to be may chance to get in the early 20s. And also after middle age, the risk of the developing appendicitis in the future is a quite small. So most probably is going to be happen inside in between the like in the late teens and also early 20s, and also may chance to get in the middle age people, the risk developing acute appendicitis is in the future is a very quite small. So it may chance to get the appendicitis, chronic appendicitis, or that means is because of the is a progression of the infections or inflammations may use the appendicitis. But acute one is going to be happen in the early 20s. So what are the causative factors? What are the etiological factors? So there is no unifying hypothesis regarding the etiology of the acute appendicitis. So until now, there is no exact causative factors for the appendicitis. So and also while appendicitis is associated with the bacterial proliferations within the appendix, as no single organism is responsible, and mixed growth of aerobics and anaerobic organisms is usual. So until now, there is no exact causative factors is unidentified in the acute appendicitis. So it may be because of the bacterial proliferations. So especially is going to be the aerobic and anaerobic organisms. So both are going to be the causative factors for the acute appendicitis. And also, if is there any another causative factor, any obstruction in the appendix. So if any obstructions such as any is a fecalith materials, so that is because of the any fecal materials or any calcium phosphate and also bacteria and epithelial debris. So if anything occurs in the appendicitis, so may chance to get the obstructions. So it may give the acute appendicitis. And also next one is the obstruction of the orifice by the tumors. So is there any tumors in the appendix? That is the carcinoma of the cecum is the cause of the acute appendicitis in the middle age and also in the elderly. So these are the causative factors for the acute appendicitis. So these causative factors are especially is because of the any obstruction in the appendicitis. The obstruction may be any fecal matter. So that means any like a wastage material, fecal material, and also is going to be any calcium phosphate and also bacterial and also epithelial debris. Any waste material, if any obstruction in the appendicitis, it may give the obstruction in the appendicitis, it gives the acute appendicitis. Or in case of the any carcinoma in the cecum, may chance to get the acute appendicitis.